Welcome to the Working on Wellness On-Demand Learning Series. I'm Jen Anderson, Clinical Quality Improvement Director for Community Health Association of Mountain Plains States, also known as CHAMPS. CHAMPS supports the needs of health centers in Colorado, Montana, North Dakota, South Dakota, Utah, and Wyoming. Each episode of this on-demand learning series was brought to you with the generous support of our partners at the Rocky Mountain Public Health Training Center. Each of the episodes in this series was recorded in June of 2021, and each provides a different presentation from an expert in the fields of psychology, resiliency, or mindfulness, and are designed to help you reflect on your state of being following the COVID-19 pandemic. Some episodes offer tips for personal resilience, some focus on the specific needs of healthcare providers, and some will help you think about your opportunities to support others in the organizations that you're a part of or that you lead. Each episode is available for you to view and share with others at your leisure. Additional resources to accompany each training can also be found on the CHAMPS website where these recordings are housed. We hope that attending this on-demand training will enable you to bring new skills and tools to your job and strengthen your ability of your health center to deliver the highest quality primary care to your communities. When you're done watching this presentation, please take a moment to complete the brief evaluation that can be found linked under the presentation. For this episode, we will hear from Dr. Christine Runyan. Dr. Runyan is a clinical health psychologist, professor at the Department of Family Medicine and Community Health at the University of Massachusetts Medical School and co-founder of Tend Health. After starting her career as a psychologist in the U.S. Air Force, she focused her research, clinical service, and teaching on behavioral science and family medicine, as well as promoting the models of integrated primary care. Dr. Runyan is also a mindfulness teacher at the University of Massachusetts Center for Mindfulness. At the height of the pandemic, recognizing the undeniable need for expert mental health services for healthcare professionals, she launched Tend Health. Tend Health provides specialized, private, and accessible mental health care and education to healthcare professionals and consultation to healthcare organizations willing to invest their most precious resource. Links to a number of additional recordings of Dr. Runyan's perspectives on COVID and mental health can be found in the additional resources for this video. Tina, thank you so much for sharing your time with us. Now over to you.
Thank you, Jen, for that warm introduction, and a welcome to all of you who are watching this, and a deep bow of gratitude, actually, for your presence and the work that you've been doing, particularly these last 16 months in the time of the pandemic. I'm here to talk with you about something that we are all very familiar with if we work in the healthcare space, which is our inner critic, and to try to unpack this a little bit, see if it is our friend, our foe, or neither. So I don't have any conflicts of interest. I am a co-founder of Tend Health, and at Tend Health we do provide mental health and well-being services to individuals and organizations. There's nothing about my role that is going to influence the content of this presentation at all, other than in that role I've seen many healthcare professionals during these last 16 months in particular, and have had many conversations about the inner critic. So what I'm going to hope to do in this presentation is to look at the origin, function, and the habit loops that gets formed around our inner monologue for most of us, and how that is implicitly and explicitly reinforced for a lot of us through health professionals training. I think it's important to also name our internal resistance to quieting the inner critic. It's one of the reasons it's around, and I found it extremely valuable to have people get pretty honest about their hesitancy to release the inner critic. To be able to begin some strategies of recognizing the inner critic early when it's a quiet voice instead of that loud screaming voice in our head, and then talk about some specific strategies to quiet and to leverage a more nurturing voice that can better support our well-being and still help us achieve the very high standards that we have for ourselves. So I'm going to start with a story that some of you may be familiar with. It's an old parable about a grandfather talking with his grandson. It's in the Cherokee tradition, and he tells his grandson that there are two wolves that live inside each of us. One who is harsh and critical and sometimes actually quite mean, and the other who is loving and kind and nurturing and compassionate. And the grandson thought about this for a little bit, and he said, Yeah, I think I have those two in me. But Grandpa, which one wins? And the grandfather replies, whichever one you feed. So I want to just start by naming that we all have inside of us an inner voice that is pretty harsh and critical and probably serves some really critical functions for getting our needs met at some point in our life, and maybe even helped us feel like we were getting ahead or getting rewarded in certain ways. And it is also true that each of us has inside of us an incredibly loving and kind and nurturing, compassionate voice. It is that same voice that shows up when we see suffering in other people. And that we all have that inside of us as well, and we're all able to provide that for ourselves. But somewhere along the way, the inner critic is sort of in the corner doing barbell repetitions and drinking protein shakes, and the inner nurturer is sort of hiding in the other corner. And so this critic gets so strong and can become so loud for many of us. But we do also have this nurturing voice. We know it because it shows up for and with other people. And this presentation and the skills that I'm going to be presenting are about getting in touch with that nurturing voice that's inside of us and learning how to leverage it a little bit more so that we can bring it to the surface in times of suffering and in times of need, not just for other people, but for ourselves as well. So for a lot of health professionals that I talk with, there is this tension between both having a sense of a lot of pride and a lot of, at times, needing to show certainty and maybe even being perceived with some ego. And underneath the surface is this part of us that feels like we're not enough. We're not doing enough. We're not smart enough. We're not capable enough. We're not technically good enough, or just we are not enough. And this tension between both showing up as though you have it all figured out, but quietly inside, underneath the surface, very much feeling like you're not enough. And this is really the root of this imposter syndrome that feeds a lot of negative messages about ourselves and about how we have to be better. So I like people to start with really trying to get a sense of your inner critic. This part of you when you feel like an imposter, what shows up for you, particularly in the professional space? What do you typically criticize yourself for? And I'm going to be asking some questions in this presentation, different than just a kind of didactic talking at you. And I encourage you to maybe have a scrap piece of paper or jot some notes down on something, or even just reflect silently to yourself as we go through. This material will have a lot more return on your investment of time in watching this if you actually wrestle with these concepts as they apply to you. So to start, what do you typically criticize yourself for? Is it about, your intellect, about your technical skills, about your efficiency? What sort of things do you say about yourself? What sort of things do you say to yourself? These often take the form of a label, and something that maybe even sounds very absolute, like, I'm an idiot. Or if I'm talking to myself, you're an idiot, for example. And how do you say these things? What is the tone of your voice? We all know that the content of what we say is yet a small fraction of how we communicate with one another. And the same is true for ourselves. So what that internal voice sounds like, and does it remind you of anybody in your life? The tone of voice, how terse it may be, this actually signals a lot to ourselves beyond just the content of the phrasing in the word. And then perhaps most significantly, what do you believe is the function of this voice? So if you stop talking to yourself in this way, then what might happen? And I've asked a lot of healthcare professionals this. So people will say things like, well, it motivates me. It helps me get things done. It toughens me up. It makes me strong. If I stop doing that, then I'll become weak. It's the only reason that I meet the goals that I have. It's the voice that propels me to jump the next hurdle and the next hurdle. It helps me be a better person and strive for perfection. And if it goes away, if I stop getting so harsh with myself and I'm syrupy sweet, then maybe I'll never get off the couch. Maybe I'll never have goals again, and I certainly may not achieve them. Other things that I hear are that I would become really selfish or self-indulgent is something else that I hear. That it's protective. It gives me a sense of security. So I encourage you to answer this for yourself. Your inner critic, not just what does it say and how does it sound, but what function do you think it has for you? Because if we can't be honest about what our own internal barrier may be to dropping the inner critic, it's going to be very hard to adapt some of these strategies because we'll have a lot of resistance and a lot of ambivalence about doing them if we hold tightly to this idea that the inner critic is actually serving you quite well. And so it's important to really look at what's here for you in terms of your beliefs. So some of you may recognize this photo or this name, Lorna Breen. She's an emergency room physician in New York City whose story became quite, the story was all over the newspapers and the Good Morning America because she died by suicide. And she was taking care of so many COVID patients in New York City before we really knew how to do any effective treatments for them. And so she saw incredible death all around her and felt incredibly feckless about her role as an emergency room physician, contracted COVID herself. Eventually she sought some treatment, and it was just a few days after she was released from the hospital in Virginia. And I had a conversation with her brother-in-law. Her brother and sister-in-law have gone on to start a foundation in her name where they're really doing a lot of advocacy around mental health care for physicians to address post-COVID symptoms and burnout. And he said that one of the things she was talking about before she died by suicide was that she couldn't go back to her job. And not that she couldn't go back or wouldn't be welcome back. In fact, the licensing laws at New York State would not have had any issue with her having sought effective treatment for her mental health needs at that time. But internally, she was convinced that she couldn't go back. She couldn't face her colleagues. She couldn't be somebody who succumbed to mental health issues or had to seek treatment for mental health issues. And it is, his opinion that that bias that she had and that inner critic that she had was very much one of the things that led ultimately to her taking her own life. And so the inner critic may seem trivial. It may seem like this thing that pushes us to be a little better, but there is a huge cost to it. This was obviously paid as an ultimate price tag, but for each of us, it can be death by 1,000 cuts. It can have a huge cost to our emotional well-being. Because when we activate our own internal critic, it keeps our internal threat system alive and activated. It keeps our physiology activated, because that kind of messaging, if it were coming at us from the outside, if somebody else were saying these things to us, our fight or flight system would be activated. If somebody is saying in the kind of tone that you're talking to yourself in sometimes, you'll never get this right. You're always messing things up. See, you're such an idiot. If somebody were talking to us that way externally, our fight or flight system would be up. We would detect a threat. And the same is true when we're talking with ourselves this way. And so that kind of self-criticism actually prolongs our pain and suffering, because it keeps our threat system activated. And it's from that place that we are just reacting to mitigate threat. We're actually not in a place where we can respond wisely or even compassionately at that time, in part because our thinking brain gets a little bit compromised when our fight or flight system is activated. We don't think as clearly. And so when we're criticizing ourselves like that, I want you to also imagine, like, what if somebody was saying that to you externally? And how would you be responding physiologically? That's actually very much of what happens even when we're talking to ourselves that way. So, looking at these images, I'd like you to reflect on what feelings are here for you. What is it that these images evoke for you emotionally? And what is your impulse to do? What do you feel like doing? You can see the universality of the head hanging low in all of these pictures, this sense of failure or even shame that's here. And it, for most of us, particularly those of us in healthcare, right, there's some kind of feeling that's evoked. Most of the time I hear empathy, compassion, care, concern. And what is your impulse to do? What I usually hear from people are to lean in, to lay a hand on, to hug, to comfort in some way. That when it is somebody else, our instinct is not to ask, for example, with the little boy, well, how much did you really study? Were you really expecting a better grade? You didn't really study that hard. That's not, that's, second, third, fourth in line, perhaps. Even if it's, our own kid and we're feeling that same disappointment, our inclination, what we are called to do in the face of suffering is to offer some kind of comfort. Except somewhere along the way, we learn and overlearn, for many of us, not to be able to do that or provide that for ourselves. So this is Dilbert reminding himself, right? Criticize the behavior, not the person. The email you send to everyone looks as if it had been written by a monkey on crack. Just to be clear, you are terrific. Everything you do is exactly what a moron would do. So he's trying to remember, criticize the behavior, not the person, and just failing at it. But when it comes to other people, usually we're much better than this. Usually we're very good at separating the behavior from the person. And so when we see somebody suffering like those in those images, we're less concerned about it being a characterological thing about the person who's always messing up. We just see this as an event, a behavior, maybe an isolated or an uncommon incident. When it comes to ourselves, however, many of us, particularly those with a very amplified internal critic, and imposter syndrome and internal critic are highly correlated. Right? The more we feel like an imposter, the louder that voice is in our head. When it comes to ourselves, we often conflate these and we take a single instance of not meeting the standard as representative of the whole in the language that we use towards ourselves. So the kinds of things that usually show up with self-criticism and the unhelpful thinking styles that are often here are these three main ones. Labeling. So we actually have a label for ourselves that's fairly derogatory and kind of global. Like instead of sometimes I do stupid things, I am stupid. I am an idiot. I am worthless. So that's labeling. Shoulding. A lot of us should on ourselves all the time. We put a lot of demands or pressure on ourselves, and all of these usually start with, I should have, fill in the blank. That one is probably pretty common and pretty familiar to most of you. And then overgeneralizing. So taking a negative instance and concluding this applies to everything. This is extrapolating the behavior to the character. So one instance now becomes representative, and we can actually remember all the things we did well. This happens a lot in feedback when we're receiving feedback. You may have received 8 points of really positive feedback, and then there's one thing in there, or patient feedback, for example, or the feedback that I will get on this presentation. If anybody gives any feedback, and I will scan the positive things, and I will find that one that just, ouch. This is a sense of overgeneralizing, that we over-focus on the one thing, that negative thing, and we blow it up. And we generalize it, even in the face of competing evidence that may have all these other positive pieces of feedback. So again, here are some examples of each of those. Right? Generalizing can also take the form of pretty extreme language around always and never. Those are usually pretty good red flags when you're having that as part of your internal monologue. I always do this, I never do that. That you're in one of these unhelpful thinking styles. And so what gets in the way of being kind to ourselves? Well, we have these resistances, which I hope that you've named. And then we also have these feedback loops that happen for us internally. We get very practiced at particular messages. So you may have found that when I ask the question, what do you typically criticize yourself for, and how does that sound? You may have actually come up with 2 or 3 right off the bat, because it's a habit loop. And when we do that, it's as though we think we are doing something helpful or positive. We've done it so many times, it is a habit loop. We have these ways of getting caught in these loops that are not helpful or skillful, but we've repeated them so many times for so many years, it's kind of the go-to. So the image that's up here is the image from The Little Prince. If anyone's read that book, The Little Prince, and the little prince is trying to make sense of the world, and he goes and inhabits all these different planets or he visits all these different planets that are inhabited by all these different beings, and one of the planets he goes to is inhabited by the drunkard. And he says, "Oh, well, it's just early. What are you doing this morning?" He said, "Well, I'm drinking." He says, "Well, why are you drinking?" "I'm drinking so that I can forget." He says, "Oh, what are you trying to forget?" "I'm trying to forget that I'm so ashamed." "What are you ashamed about?" "That I'm drinking." So this is an example of this kind of thought loop that can happen, and habit loop that can happen quite behaviorally. And these thoughts are internal behaviors that we can get caught up in. And then we enter the environment. And so some of you may have also heard this little parable. It was from a commencement speech, George Foster Wallace in 2005, where he started that speech by talking about sometimes the things that are most obvious and yet hardest to talk about. And so the story is that there is these 2 fish swimming along in the water, and an older distinguished fish comes and swims by them in the opposite direction. And he says, "Morning, boys, how's the water?" And the two fish swim on a little ways, and then one of them looks at the other and says, "What the hell's water?" And so it's this commentary on that which is all around us. Sometimes can be hard to talk about and hard to recognize. And I think that is a lot of the culture of healthcare, honestly, and the culture of healthcare training. We have some good, there's some good studies on this. I'm just pointing out one. It's a bit dated, but the data is not much better. That, we look at well-being for medical students. When they enter medical school, their sense of mental health and life satisfaction is higher than their age-matched peers. And by the end of medical school, it is lower. And they're all engaged in something that is meaningful and is setting them off on a career that is going to sort of ensure that they have a job that is going to have a lot of meaning and purpose and is going to have some financial stability. And yet their mental health and life satisfaction is lower. And there's a lot of other evidence for this around depression and anxiety in terms of medical students, both within the US and without, and this pressure to conform. And there is a culture, there is the water that we swim in healthcare, and becoming a healthcare professional, whether that's a physician or a nurse or an ancillary healthcare provider. And we choose for and select for culture fit. We want people who can swim harmoniously in the waters that we swim in. And so it gets reinforced over time. And there is a pretty strong hidden curriculum in that around adhering to the culture. At one institution, there's some rebranding happening around being relentless, providing relentless health care. And this is a quote of what that means to be relentless. And it ends with, "Being relentless means running on empty stomachs but full hearts." It's actually a statement around denying one's own needs, one's own biological needs. This is the waters that we swim in. If you haven't read the book, The Tennis Partner by Abraham Verghese, it is a sad and poignant tale. This is just one excerpt from the ends where he says, "The doctor's world is one where our own feelings, particularly those of pain and hurt, are not easily expressed. The citadel quality to medical training, where only the fittest survive, creates the paradox of a humane and empathetic physician who shows little humanity to himself." And I think you could replace, nurses' world with that, and probably a lot of other, psychologists' world, where there's so much outward emphasis on empathy and compassion, but showing very little humanity to oneself. There seems to be a different set of expectations that actually get highly reinforced through that hidden curriculum, through what the expectations are and what gets reinforced in those settings. And so that's culture. That has everything to do with culture, and culture eats strategy for breakfast in organizations. And so there's this outside culture, and that influences and correlates over time with our inner culture. We all have a culture inside of ourselves as well. And so the antidote, if you will, to quieting this inner critic, to recognizing its presence there. We're not going to get rid of this other wolf. We're not going to get rid of this other voice. But how can we strengthen the nurturing voice, the other part that is innate in you? So just as I think compassion is an elixir to all sorts of suffering in the world, self-compassion is actually a evidence-based tool to meet this inner critic. So what is self-compassion? It's not just being kind to yourself and doing lots of self-care and getting massages or taking a mental health day. That's not what I mean by self-compassion. So self-compassion is a term that was coined by Kristen Neff and Chris Germer, and it has 3 components. The first one is a sense of mindfulness, of recognizing a moment of internal suffering, recognizing when your inner culture is in such a state that it's very fertile ground for that negative voice to be there, and to just have an awareness that it's there. That's a sense of mindfulness. The second is common humanity, which is that suffering is universal. All humans suffer. And as isolating and lonely as suffering can feel and can actually draw us into that isolation, when we can open up to the reality that suffering is part of being human and that people are suffering actually in the exact same way now that you may be, at some point in this world, there's somebody who's suffering very, very similar to how you're suffering. And so it's this greater sense of not being alone. And then the third component is self-kindness. Now, it's true that this is often the component that is most challenging, but I think of it much more as an internal stance towards ourselves rather than traditional self-care of doing something nice for oneself. I really think about it as, how am I talking and treating myself internally in this moment of suffering, in this moment of hardship? Things didn't go quite the way I wanted them to go. How am I towards myself? If I'm one of those people in the picture that's doing this, what is the internal monologue at that time? Is it one that says, this is really hard, you're doing the best you can? Or is it one that's using some of those unhelpful thinking styles, saying, you did it again, you failed again, you're so stupid, right? Whatever your version is. So when I say self-kindness, it's something that's very portable, actually, and something that you can, bring to the job in a day-to-day basis. It's not just about doing things that are caring and kind for yourself in a concrete way outside of work. And so for those of you who might be getting a little resistance at this idea of being kind to yourself, or thinking somehow that the more compassion you have for yourself means the less you have for other people, as though it was like a fixed pie chart, like that there's just a finite set of compassion, and right now you're 10% to you and 90% to other people. And if you open and broaden that more to yourself, it means less for other people. That compassion is actually infinite, and there's not a finite amount. And there is a strong correlation actually between being more compassionate to oneself increases your compassion towards others. And so this idea of kindness for self and kindness for others is really that sweet spot of true compassion, and can actually help us not be in this place of high kindness for others and low kindness for ourselves, which is a place of unhealthy altruism, and often a place where fatigue and burnout can begin to take root and blossom. So how do you address these unhelpful thinking styles, more specifically under this framework of self-compassion? Before I go there, I want to just say that there is a school of thought from internal family systems theory that really talks about this self-critical voice as just trying to keep things in control and trying to protect you. And it is there to course correct as need be, to help us from, if we do something that we feel is bad and we feel a sense of guilt, like that helps us course correct, right? Oh, I don't want to do that again. And so this self-critical voice may just be trying to protect you. And what we can learn is that it's going to be a part of our our psyche and a part of our thinking. It doesn't need to be ignored. It doesn't need to go away, but it also doesn't need to be in charge. It doesn't need to be in the driver's seat. And so I just referenced this for anyone who's interested in learning more about that can go to internal family systems. But I want to talk about a little more in terms of self-compassion, the impact of self-compassion when we learn how to address these unskillful thinking styles. There's a whole host of things that are on offer for becoming more self-compassionate to address these unhelpful thinking styles. And so, if one of these things doesn't do it for you as far as the evidence of what happens when we're more self-compassionate, maybe there's a combination of things on here that get you curious and thinking about what's on offer when we're more compassionate to ourselves. There's a 2020 study done by Kristen Neff who found specifically with clinicians that depression, stress, and I think this is very telling, secondary traumatic stress and burnout are decreased. And this has a lot to do with our capacity to sit with and be with suffering, not just other people's, but our own. We've all been through so much the last year and a half. So if I can meet my own suffering with this stance of kindness and common humanity towards myself, where I'm going to experience less anxiety, less depression. So an invitation here to practice a little bit, because it is a skill, and it is something that gets easier and stronger with practice. So I'm just going to invite you to do this with me, and it's a rubric that you can follow. So to think of a time in the past 2 weeks when you were feeling quite distressed, something that's still maybe distressing to you now. Not something that's a 10 out of 10. Don't pick your most distressing thing, but also not something that was like a minor irritant, like a 1 out of 10 on the scale. Not something that was just, you ran out of coffee and had to stop and get coffee on the way to work. Something that actually holds a little bit of juice there. And then, as best you can, sort of putting yourself into that moment, imagining that setting. See if you can bring some of your sensory experience to it. So, where were you? What colors were around you? What room were you in? Notice anything about the sounds around you? Anything notable about the smells? So kind of putting yourself into that position where you are feeling quite distressed. And then see if you can bring to mind what tape was playing in your head. What was the inner voice? And how were the feelings? This is just a very concrete way to look at how we typically meet our own suffering. And can you, going back to this early inquiry, were you criticizing yourself? What for and how did you say these things? Is there any tone to your internal voice? And now we'll see if we can meet this with self-compassion. So as much as you're putting yourself in the same situation, what if you say to yourself, and do it even now, this is a moment of suffering. This is hard. Recalling your own humanity. This being human is hard sometimes. And if I was right here with somebody I care about, with a friend, what might I say to them? If I was privy to what was going on in their head, if they were saying that out loud, what might I say to them? Can I just talk to myself the way that I would somebody else, even out loud? As you're learning this, sometimes it's actually really helpful to say these things out loud. And then the quintessential question of self-compassion and self-kindness is, how can I best take care of myself in this moment? What would serve me best right now? When we can get a little distance and step back and actually have some mindfulness to say, what is called for in this moment? And if nothing else, we interrupt the deluge of self-criticism is a really good place to start. So calling upon what I call your deepest anchor of kindness, and then finding one thing to say to yourself. And at first it might be in addition to all the negative stuff. And eventually it may be instead of the negative stuff. So here are some examples of some things that other people have come up with to say to themselves. I'm human, I'm doing the best I can under the conditions that exist. May I forgive myself for things left undone. If you're a should'er, if you're somebody who does a lot of shoulding on yourself, may I forgive myself for things left undone. I've used this one a lot the last year and a half. And I encourage you to just jot down something or think of something right now that you could offer and say to yourself that may be very kind and maybe skillful. And if you have it in your back pocket, it may every now and again occur to you to offer it. So I'm going to give you one additional kind of cognitive tool to think about how you talk to yourself internally. And this is I think it's from the Sufi tradition. It talks about 3 gates in all of our speech, and that our speech should be able to pass through 3 gates, most notably our speech to ourselves. Right? Is what I am saying true? Is what I am saying necessary? And is what I am saying kind? And see how you're talking to yourself. Can it pass through those 3 gates? Often things will falter at gate 3. Is it kind? Is the speech that I'm using internally kind? And if it's not, perhaps calling upon that mantra, that deepest wisdom that can offer you something, even in the moment. It doesn't have to be saccharine sweet. It doesn't have to be over the top. It may just be, I'm okay. It's okay. I'm not perfect. I'm human. Nobody's perfect. These are the kinds of ways when we can meet our own hung heads like this. This is actually what motivates us to get back up. This is actually what allows us to keep going. Being kind to ourselves and treating ourselves internally with kindness doesn't lower our bar. This isn't about setting lower standards. Keep your bar as high as you want it. Set very high standards for yourself. This is just about meeting our own humanity in those moments where we don't quite hit it. Which my experience in working with healthcare professionals, because the bar is set so high, oftentimes, this happens. This will happen in a day, a week, a month, a lifetime. It will happen. And how you meet yourself in that moment can either prolong your suffering, or it can actually be the foundation of incredible growth and strength and how we would meet somebody else in their own suffering. And if you're having trouble finding a way to do this through your words, through the cognitive process, we can also do it through our own physiology of being kind to ourselves. So if you can't come up with a way to be kind to yourself in just one word or phrase, you can actually do it through your own body. Our nervous system knows touch. When some of you saw those pictures, you may have been like, oh, I wanted to give a hug. we can actually greet ourselves that way in a moment of suffering. A hand on your heart, talking to yourself in a gentle tone. Things that evoke care and compassion, music, poetry. And then the question that I really encourage people to invite into their everyday, because we don't need any help remembering the things that went wrong, but we do need a little help to incline our mind towards things that went well, or particularly things that we did well. So maybe asking yourself in a moment of suffering to also say, what did I do well today? Or you could say, what did I learn today? What did I learn today? What did I do well today? What often comes up are going to be expressions of self-kindness. And just as a reminder, we don't do this, the instruction, I suppose, is that we're not doing this to specifically feel good. You may not feel good if you use these concepts in a moment where things have gone poorly, or there are a lot of personal distress. You may not feel better in the same way that if you have a friend or a loved one who's really suffering, your words may not turn things around in an instant, and they may not even feel better. But you show up that way with a stance of compassion. We show up that way to our patients, to our family and our friends. And we show up that way in our language, both the tone of it and in the content of it, because somebody is suffering. They may not feel better, but because somebody is suffering. And I love this invitation from Mary Oliver in her poem, Wild Geese. She says, you do not have to be good. You do not have to be good. You do not have to walk on your knees for 100 miles through the desert repenting. You only have to let the soft animal of your body love what it loves. And that's just a reminder to know that our bodies know love, our bodies know tenderness, our bodies know care, and that we can offer that to and for ourselves. And that voice is inside every one of us, every single one of us. And it gets stronger and louder the more we use it. The more we feed it, the bigger it becomes. It doesn't mean that the other one goes away completely. It's just this one starts to become much more of our default. So I hope you find yours. I hope you use it often. Thank you.